Hey everyone, it's me Christina. Today we're February 28th. I'm coming on today to make a quick video. Well, I hope it's going to be a quick video. Just to let you guys know how I'm doing since my plastic surgery. Like I said, you guys all know I had plastic surgery done on January 24th. Inner thigh lift. Have a cut going down my leg about 15 centimeters. Plus I got lipo done on my hips and on my left thighs. So that's it. Last video I made, I was 9 days post-op, I believe. I was in a lot of pain, taking pain medication every 4 hours about, plus Tylenol. I guess you could say 2 weeks after the surgery, I was just exhausted. You know, just the fact of constantly sitting on your ass, not doing anything. Couldn't do anything, first of all. I couldn't move that much. I was in pain. I didn't know how to place myself in bed. I had all these pillows and I wasn't comfortable. I had a pillow underneath my butt, you know, 2 underneath, my knees, and 3 like underneath, behind my back, and I still was in pain. The stitches underneath my butt crease were really pulling, and I guess that is what was causing me to have pain. Because the minute I would put my legs straight in bed, the skin was pulling. Even one night, my boyfriend, I took off my undergarment so he could wash it, and I was so swollen that the minute I took my undergarment off, I could feel my legs throbbing, and I was in pain, crying. The whole time he was washing it, and I had to wait until he dried it, I was in pain. I couldn't, sit still in bed. It was crazy. That was, I wouldn't want to go through with it again, actually. But since then, February 6th, he took out half of my staples, and just the fact of taking half of them out, the pain went down so much. So I guess it was really the staples that were causing me to have that much pain. The staples going down my leg, it wasn't so bad because I'm pretty numb in that area. I don't feel that much. It was mostly the ones in the groin area that were pulling, and the ones on my butt cheek, underneath my butt cheek. So that was the ones that were really annoying. So he took half of them out. February 13th, he took all of them out. The ones in my butt crease, again, were the most painful ones to take out. The skin was really sensitive. I was almost screaming at the doctor's office. So yeah, that's it. A couple days later, I developed a little abscess in my right groin area. I had an abscess, actually. I had a big bubble that started forming, and that was within 1 day, I guess. And that night, the abscess busted while I was sleeping. I went to the bathroom and I had all this pink, thick fluid that was coming out. I had to drain my abscess actually manually. I pushed on my skin until actually I saw clear blood coming out, and I knew it was, pretty much empty. Started putting a couple bandages. It was a tiny little hole, guys, like the size of a pea, but a lot of, fluid was coming out of there. Called up my doctor, the following morning, and he said that he wanted to see me at the hospital 2 days later. Since it stopped leaking, thick fluid, he said it was okay to leave it like that. So for 2 days I had, a regular bandage on it. It was still leaking a little bit, clear fluid. He saw me at the hospital on February 20th, and the hole still wasn't closed. So he actually cut me open a little bit with scissors, and I didn't feel a thing, guys. I wasn't frozen, nothing, but just the fact of being numb all in that area, I didn't feel a thing. Which was good, because I don't like being in pain. So he cut me open, and since the wound didn't close, he told me that the wound didn't close on the inside and it closed on the outside. That's why I started having this abscess. So after he cut me open, the doctor decided that I needed to go to the clinic near my house every day to get a bandage done. They actually filled up my wound with some gauze. So since February 20th, now it's been a week today, I've been going every day to the clinic. The nurse, does my dressing and everything. The first day the wound was 2.5 centimeters deep, and today it was 1 centimeter, so it's improving. I have no infection, no nothing. The doctor didn't prescribe antibiotics for me. He thought, that I would be okay. And everything's going great for that. I don't have any more pain, guys. Even when the nurse does the dressing, I don't feel a thing. I don't feel cold water. When she cleans it, nothing. Which is good, you know. The doctor told me it's normal to, you know, be numb like this after a big surgery. I guess eventually I'll feel, you know, sensation again in my legs. But that's it. So since the staples have been out, the pain is really just like gone. I mean, I'm sore. You know, at the end of the day, if I move a lot, I'm sore a little bit. My legs, my hips are still sore, I guess, from the lipo. I don't have bruising on the outside. I guess it's just on the inside of my skin. I still have bruising from the lipo. But the pain is just mostly gone. It's just soreness. Of course, I was supposed to go back to work on February 25th, but since I have the wound, I'm off for another 3 weeks. I only go back March 18th if everything is okay. But if it wouldn't have been for the wound, I could have went back. I'm able to walk, I'm able to sit, I'm able to bend. I could do everything. So that's about it. Today I weighed myself. Let's talk a little bit about the lap band. I was 152. I don't like being over the 150s, but I was 149 the day before my surgery. So it's, you know, it's not that bad. Of course, I'm not exercising because I can't. I walk a little bit. I do as much as I could, you know, but I'm not doing a lot. I mean, I'm mostly sitting down, watching TV, eating. So, you know, I guess that's why I'm gaining a little bit. But I can't wait to get back to my regular routine, you know, working. And I can't wait to go to the gym, guys. It's been so long. I actually bought myself a mini iPod that I could actually clip to my shirt. And that'll be really good for when I go to the gym. So I got that. At least that's already done. It's been about, I think, 5 days. I've been putting this oil on my skin, on my scars actually. Bio oil. My doctor told me I didn't have to put anything. He said it would, you know, my scars would heal by itself. But I don't want to take a chance. I mean, if I could do anything, like, I'd rather do everything that I could to make my scars really, really nice. Because it is on my legs. I am going to wear shorts and skirts and whatever dresses this summer. And, you know, I don't want the scar to be all nasty. So this is it. I've been putting this for 5 days about. And I also ordered some silicone sheets off the internet, a website. The company's in Florida, actually. So it's a big silicone sheet that will cover both of my legs going down, but not my butt, though. And that was about 50 bucks, so I'll see how that goes. The nurse told me today that if I wanted silicone sheets, the doctor would have to prescribe it to me. So I would need a prescription. I'll ask him that the next time I see him, and that's on March 2nd. No, sorry, March 12th. So, you know, until then, I'll be using this. Show you guys a little bit what I look like. I'm actually wearing my underwear from my bikini. This is what I look like. Now, of course, doing this inner thigh lift, I thought my legs were going to be a little bit more tight, you know, but I guess you can't expect miracles. Even the doctor told me I wouldn't, you know, ever have smooth legs. I would never look like a model, and I know that. I don't want to look like a model. I guess just my expectations are very high when it comes to my body. I'm never satisfied, I think. But it's still, you know, a couple days after the surgery, I wasn't satisfied until I actually put my bikini on and I saw the difference of before and after. I had really big hips, like right here. One of my hips here is higher and the other one's lower. I don't know why, but anyway. But all here is really, like, there's a big difference. I mean, it was so big, my hips before. And my legs are tighter than what they used to be, you know. Of course, I believe that he could still take more, but I think it's just my muscles underneath. I guess that's why he couldn't take more. I guess exercising and everything, that'll really help because it's not that much fat left. Even here, I'll just pull this down a little bit. I had a lot of fat here actually sticking out, and he did lipo all here, and of course, you know, there's still some of it left. He told me to get rid of all of it. I would need to get a tummy tuck. So, but you know, it's much better than what it was. I'm able to, you know, wear my bikini without, you know, big bulges sticking out. And actually, when I wear a bikini, I believe that maybe I might not need a tummy tuck. If my stomach looks like this after I have kids, I think if I just get a lot of lipo, like here and maybe on my back, I think I might be okay. But sorry guys, my camera cut off. Like I was saying, I'm not, I guess my expectations of my body are really, really high. I would think that the doctor could actually, tighten this more. But anyway, maybe with exercise, my legs could be really, really, well, maybe not really tight, but I guess they could be tighter than a little bit what they are now. This is my wound, like I said. It's on this side, little wound right now. I'll show you guys a little bit what my scars look like. I don't know if you guys could see. This is what it looks like. Of course, I mean, right now on camera it really looks bad, but it's not that bad. Still pretty fresh. It's only a month and 4 days out. I do have, I can't show you guys the ones on my butt, but they're even lighter than this. So I hope that the silicone sheets are really, really going to help. I'm going to show you guys my lap band scars. I don't know even if you could see them. I have, the biggest one is right here, and it's all white. Like, you don't even see them, So if my scars could be like this, I would really like that. So, I still have to wait. It'll probably be like a year, I guess, or even 2 that the nurse said where, the scars are completely healed. But yeah, that's what my scars look like. Like I said, I'll post some pictures of my wound and, of course, my scars. And that's about it, guys. Sorry if the video is a little bit weird. It cut off, and I don't remember where, it did cut off and what I was saying. But like I said, that's what my body looks like. Of course, it's not exactly what I thought it would be. I guess my expectations were really high. Thought my legs were going to be like, really smooth and tight. But, the doctor told me that I would probably never have like super smooth legs and I wouldn't look like a model. But anyway, I guess that's just me, I have, it's really hard for me to accept, what I look like. Maybe eventually one day I'll be able to accept what I look like, and, anyway, well, I'll take it one day at a time. So have a great weekend, guys, and I'll talk to you guys soon, okay? Bye.